RotaCare Bay Area is a volunteer-driven organization of free medical clinics throughout the greater San Francisco Bay Area. RotaCare has over 1,000 volunteers, including physicians, nurses, support staff, and interpreters. RotaCare Bay Area was founded in 1989 by Dr. Mark Campbell when he identified the need of local community members who had limited access to primary health care.
Since its inception, our organization has evolved, yet our mission has remained the same: to make high-quality care accessible to those who cannot afford it. This is especially important for individuals in marginalized communities who are often unable to access high-quality health care due to lack of resources or lack of insurance. Together, we serve thousands of patients each year and make a real difference in their lives.
RotaCare saves taxpayer dollars by providing patients accessible medical care in our communities rather than the expensive emergency room care. There are two unique things about RotaCare. We provide free medical care and do not receive any reimbursements for visits, and the organization is volunteer-driven. Services have expanded to include more chronic care management for diabetes, hypertension, and asthma. Some clinics are also offering healthy eating and exercise classes. With the changing times, the clinics have moved towards a paperless system with all the RotaCare clinics using an electronic healthcare record system. RotaCare clinics will continue to evolve as the needs of its patients change.
This building that we're in now is the Kaiser Downtown Medical Office Building. Kaiser donates space for free for us to use for our clinic. Marin Health donates imaging services for free for us to use for our patients. And Sutter Foundation Hospitals donates laboratory services. So we don't have to pay for our space, our laboratory services, or our imaging services. We have good relationships with Planned Parenthood for women who need women's health services and Operation Access for the need for any kind of surgical intervention. So yeah, the organizations that have other touches, especially in the insured population. So if somebody, for instance, loses their insurance, they may get referred to us to be seen until they can recover their insurance. But it's a very nice thing in Marin to have, the three what otherwise would be competing organizations, Kaiser and Sutter and Marin Health, operating in tandem and in concert to support an organization like RotaCare. We now have our own licensed pharmacy through the state so that we have our own pharmaceuticals with a pharmacy director. And it's nice to have that in-house and have it under control.
I connect with people really, really fast. Right here. Patients, they come. Sometimes they tell me things they don't tell the doctor. And so when I'm interpreting from them, when the doctor walk away, they tell me things. So I have to follow the doctor and tell the doctor, hey doctor, the patient say this, and that.
A pesar de que llegamos acá así, o sea, como quien dice.
I don't have a job currently, and I haven't been able to work due to my injury. I came here not knowing the services that I could receive, and the therapy that I have received has helped me tremendously. I didn't think I was going to move my knees again, and I'm able to walk. I'm not sure what the price would be for a physical therapist, but I'm sure it would be a lot of money. It's a great clinic. We are treated well, and everyone has patience for the patients.
Sí, muy recomendable, la verdad.
I try getting insurance somewhere else. I went around and around, I couldn't get it. And when I went to RotaCare, they didn't ask me for nothing. And then when they find out I have diabetes, high pressure, and all that stuff, they take me like their own people. And they are really, really care about people, especially when they're real sick like me. I make an appointment with Dr. Angelo through the video phone call. So, and then when the time they call me and say, oh, and then she asked me what was the reason for me to make the appointment, and I said, because I got a swollen leg and my foot is swollen. And then she said, can you show me? And I said, sure. So I showed my leg, and then I showed under my foot. And then soon she saw that, she said, I'm sorry, Samuel, this conversation is finished. I want you to go to the General Hospital in San Mateo and go right now in emergency room, emergency place. I'll call for them to wait for you. So thank you. Thank you for the doctor. If I didn't show my leg, I would lose my leg. I would be gone, man.
We try to treat everybody with respect, dignity, and compassion.
What brings me joy is offering care to patients who otherwise wouldn't get it. That there are people in dire need in our community who would otherwise be without healthcare services because of the nature of healthcare delivery in our country, which I firmly believe needs to be changed. The other thing that gives me joy is just working with the people of RotaCare. Everybody's here for the same reason. The people who volunteer at RotaCare want to help the community, and they want to help the people most in need. So that keeps me coming back. It keeps me fired up. I mean, as you can tell, I'm kind of getting along in the tooth here. And there will come a day when I won't be able to do this anymore, but I'll keep doing it for longer because it helps me sleep better at night.
RotaCare Bay Area leads with kindness and a sense of purpose that is unmatched. It is an act of the highest kind, and I am proud to be part of this remarkable community. Thank you for your support and for being here, and for your generosity and for your compassionate hearts.
RotaCare is the safety net below the safety net, and clinics will continue to provide free healthcare services to those in need.